Hello and welcome to Sensei Podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei Podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello everyone and welcome to Sensei Podcast. It is my great pleasure today to introduce Dr. Ashok Seth, who is well known to everyone. He is the chairman of the Fortis Escorts Heart Institute in New Delhi. He is also the chairman of the Fortis Healthcare Medical Council and the president of the Asia Pacific Interventional Society. So, Ashok, thank you so much for being with us today. Congratulations on a very successful CHIP meeting in India recently. And we're delighted to hear from you.
Thank you very much. Thank you, Dr. Brilakis, and I'll call you Manos from here on. But it's wonderful to be with you, and it's going to be a wonderful conversation with you.
So, Ashok, you've recently lived interventional cardiology from the early days. And I know it's much easier now than what it used to be, back then. So you want to relate to us, how did it all start for you? How did you be able to develop such an amazing expertise in a variety of interventions?
I think it's a tremendous question, and it's clearly going back into the 80s, in the mid-80s, when I started learning PCIs, it was extremely crude. So I won't say I was the first few, that was, as you know, the late 70s, but it was early 80s that I started learning PCIs, and we had these balloons which wouldn't go down the arteries, and we learned how to deep throat 9 French guides into coronary arteries to get really high-profile balloons out. And when the steerable wire came, it was absolutely fascinating that you could steer a wire even down the coronaries. But the most fascinating aspects of my life were when I saw Jeffrey Hartzler do cases. And I was in the very formative years of my life, and I couldn't believe that there was someone, while we were doing single discrete balloon angioplasty lesions, treating them balloon angioplasty, there was Jeffrey Hartzler, and I went to him and I watched him do cases, and I was amazed. He was getting wires down, going down vessels. By the time he was dilating a lesion, going to the second lesion and the third lesion, he was always watching the first 2 lesions. And by the time he would finish a case, 7, 8 lesions in 3 vessels would be done. So there was, that was truly almost different world that I saw when he was doing it. And I said, well, he became one of my icons as I then, after sort of 10 years abroad, returned to India. Clearly, I was pushing the boundaries. And those were the days when the surgeon was breathing down your neck. And you're rarely ever going to see that happen anymore, ever in your lives. We had an hour of a slot to do a PCI, and that was called angioplasty. He would say, okay, between 2 cases, I've got this theater standing by. And then there would be a phone call saying, what are you doing? Are you crazy to dilate this lesion? This is proximal LAD. They do so well with my grafts. So how come you're doing such things? And it was always breathing down the neck. When 5% of these patients would have an MI, you can imagine that our only saviors were the surgeons. There was this guy who would dissect the artery. We would try to keep it open, or it would be 3-4 hours later in the CCU. It'd suddenly have a crash. We would resuscitate him, bring him down, and then we'd ring the surgeons. And the first thing the surgeons would say was, I told you so, not to be doing this. This crude technique of yours is never going to work. And why don't you just understand that bypass surgery is an established technique? So it was stretching the boundaries. And when we started going to 2 and 3 vessels in pre-stent era, it was truly a belief in a technique and a technology which was very crude at that time. See, I mean, if I was to tell you, Manas, that at present times, if you said 5% would have an infarction, 2% would need emergency bypass, and 1% would die, it would be unethical even to do an angioplasty. And yet, well, that was the best we had, but we believed in the technology, we believed in our skills, and we pushed the boundaries forward. But one of the funniest things, of course, was the early days of alternative devices in the early 90s when I started doing them in the country and extending the boundaries. If I was to tell you that the first directional atherectomies I did was through picking up guiding catheters and cutters from some of the labs I visited in the United States in 92, bringing them back, sterilizing them and saying, directional atherectomy, here you are, in India and Asia, I've got directional atherectomy for you, because that time the device wasn't even available in India and perhaps just coming to Asia. So yes, and that's what, and can I just add to that? No stents, so no bailout, crude devices, poor antiplatelet therapy. In fact, practically apart from aspirin and Pasantin, we had only Dextran as the other infusion to keep vessels patent. And therefore it required a lot of guts and a lot of belief. And we gradually evolved science through directional atherectomies, rotational atherectomies, tech. And finally, the biggest relief was when the Parma Shot stent came to us. At least those emergency issues got sorted out. What was then more important to sort out was restenosis. So, fascinating era of really breaking boundaries in the face of numerous challenges, would I say? Funny, manner. Can I just relate to you a fascinating case? So, when I told you breaking boundaries, when we had directional atherectomy, we would do bifurcation lesions and cut the plaques out from both sides and have a pristine looking bifurcation, which some of them would not restenose and would be beautiful, even at 6 months to a year. And with rotational atherectomy, which we started pushing the boundaries with rotational atherectomy, doing long lesions, even tortuous anatomy, even concertina anatomy, because there were no stents. It was in lieu of balloon angioplasty. We would do 6, 8, 10 centimeters of rotational atherectomy and just do low pressure balloon, and then it would just stay open, thankfully, in many patients, and no restenosis. So they would become the cases to present, should we say, that the 10 centimeter lesion, no restenosis, just balloon angioplasty. So there was a case I did, which was fascinates me till today. So if you were to say which is the most memorable case of yours, I would actually go to the pre-stent era. There was this case who had anomalous left main arising from the right coronary artery. He had a 5 centimeter long right coronary artery lesion. He had an ostial LAD from that left main, which arose anomalous from the right coronary artery. He then had 3 lesions down his circumflex up to OM2. And I said, I can do balloon angioplasty to this. And so 5 centimeters of RCA balloon angioplasty, anomalous left main, ostial LAD with balloon sticking out into the left main angioplasty, and all those lesions. And the guy went home. And then I said, the guy was doing fine at 6 months. So I said, let's publish this case. And got refused by 3 journals, saying that's a bit crazy thing to do. And we would not believe that our interventional cardiologists with balloon angioplasty should be doing something like this. And then at 2 years, he came back and he had chest pain and I did an angiogram. Can you believe? Everything was pristine. So I said, now I should publish this. And this was, so 92, I did that case, 94, and I then published it. And the journal, which Interventional Journal of Cardiology, accepted, saying that was a great demonstration of how balloon angioplasty can actually work, even in difficult cases. So yeah, those were very interesting days.
So it is fascinating that you had all this, the early days, as you said, the skepticism from people, and the equipment wasn't very strong, and the complications were high. So what kept you going, right? I mean, you could say, let's take it easy. With this, it doesn't look good. Let's just take it easy. So what kept you going and doing these cases?
That's a great question. I think there were 3 aspects to this. Firstly, of course, the inspiration of some of the interventional cardiologists around the world. And if I was to say, who did I actually, in the mid-80s and early 90s, who did I actually get inspired by, or who did I get close to? So I was inspired by Jeffrey Hartson, no question. When I spent the time in lab with him, it was just amazing. In the research, I was clear, it was Patrick Serraz had inspired me. I went and presented some abstracts and papers at his meeting, and I was sort of very impressed by that. Alan Cribbier became a good friend very early in the late 80s because I went to him to learn balloon valvuloplasty. Actually, at that time, it was 1987. So that was an inspiration. One of the best courses I felt was Bernie Meyer doing a lot of things, which was great. But the inspiration was truly, firstly, of course, at that particular time, to evolve a non-surgical therapy was a clear vision and a belief that this could actually be the future. There was no question. But then we had to have our expertise, and we had to be safe, but we knew no better. So it wasn't as if we were comparing ourselves to anything. We knew that this would develop further and further. But if we did not give it our best, then we would have failed science, we would have failed technology, and we would have failed the future. So some of us, and I wouldn't say everybody, there were a few who actually did give in and said, this is not going to work. But there were a lot of us who actually felt that the future lay in it, and we only had to evolve in terms of technique, technology. And we were seeing that evolution happen also. For example, somebody brought in rotational atherectomy in lieu of balloon angioplasty, and we could see that we were now doing longer lesions with safety and not, and they were looking better. When directional atherectomy came out, we knew we were a step further. We could do a better job for osteal lesions, for bifurcations, for these large vessels, and we're seeing the results. So I think technology was moving there. And while they may not have worked on a long term, we were cracking some of the issues on a year-to-year basis. And I think that's where our real confidence in the technique. So we trusted the technique, we trusted science, and we moved ahead.
So Ashok, you've done obviously thousands and thousands of cases. You have amazing experience. But are you getting nervous when you do cases now? Are things now second nature? It doesn't bother you at all? How are you feeling now after all these years and these thousands and thousands of cases when you do these complex cases that you do every day?
Do I get nervous? No, I think very early in my life, I stopped getting nervous. I was always concerned enough to go back or go through it before, revise my steps, understand the limitations of the case, think through all alternatives that would happen in the case and what could happen, be sure that I was ready to tackle them and had the expertise and the equipment to tackle them, whatever was available. And then I would go into this case confidently to say, I'm going to be able to do this case because I know that I have the ability and the mind and the thought process to be able to do it. Remember, in those days, if you were leader, you had very few people to learn to. Yes, you had others who you learned from, but then you were also a leader for 100 of others because they were looking at you to learn from yourself as well. We were expanding the whole network across India and Asia Pacific region. So yes, I still don't feel nervous about it, but my habit of being as concerned and going through, say, ticking off all the boxes prior to going into the case and analyzing it thoroughly, and then finally coming back and then debriefing myself on the case, saying, what could I have done better? Did I do everything correctly? Why was my wire in a small branch? Why didn't I notice it while I was doing the case, even though it didn't cause any problem? Why did the wire move forward when I was pulling the balloon back? Could I not have done that? So small things, which could be big issues, are always in part of my debriefing. And I do that with all my fellows as well, as soon as we finish a complex case. Just because it's gone well, if we don't debrief ourselves, doesn't mean it'll go well again or be well for every one of my fellows who need to understand a lot more. So no, I think that's an important question. But there's one thing which always concerned me, and I think I should say that. I want to also understand my limitations. I talked to you of this about my CTO skills, as you say. There was a time. I was doing when CTO came in and got sort of mature. I didn't say come in because I've been doing CTOs for the last 35 years. Even in the days of crude balloons and cruise everything, we still had the CTOs and we'd still attempt them. And then we got sharper wires and some form of sharp wires and we'd still attempt them. But we got better and better at antegrade skills, primarily because there was no retrograde skills and everything had to be felt by the fingers. And we got some better and better wires. And we were able to sense the vessels and sense the right track and therefore be able to deliver a very high success antegradely. The first time I watched a CTO retrograde, and actually it must be one of the few first cases of the world, primarily, was at a Kobe course around 17 years ago, and got tired. So there was this total occlusion antegrade going on, and I actually slept while that case, and I got up. It was jet lag, and I think it was, if I'm correct, Professor Spencer King sitting next to me, and we were watching this, and 2 hours later I woke up. And 2 hours later I woke up, I thought it'd be another case going on, and I think it was still the same case. But then I saw this wire coming from the left side to the right side, and I couldn't believe it. I still couldn't understand what I was seeing on the image. And I still couldn't understand. And of course, that case had been going on for 3-4 hours, and that he had said somewhere in between that I'll go, can we go through the collateral? And I woke up, and then I asked Spencer, what's he doing? Why do you see these wires which seem to be going somewhere from the right to the left? He says, you know what he's done? He's gone through this collateral, and he's done this and this. I said, that's weird. I said, and both of us sort of looked at it. And that we thought was weird. We thought it was out of but the case took 6 hours. But I thought it was an introduction to something so fascinating for the first time ever. So I said, this is going to take time. So I was doing 1,200 PCIs a year. And I said, do I really have the time to get into deeper specialization as CTO moved into specialization, and then true specialization, an art and a science in itself? I said, gosh, I don't think I would have the time to actually take up this as a specialization. As long as I'm good with my antegrade skills and get up to 75% of my antegrade skills, I said, I've got always specialists whose Manus is there, and Manus is going to train hundreds and hundreds of other specialists who are going to continue to do retrograde and most complex CTO techniques. So I therefore went into every other aspect of complex PCIs, but not into a super specialization of CTO, where I always have my colleagues to help me out.
No, that's actually a very good sign of maturity. Some people try to do everything, but as you said, if you do 5 retrogrades a year, I'm not sure you're doing anyone much of a service. So understanding, what someone is doing, I think actually is a huge sign of maturity, and it's the better way to go. But still, I'm very impressed, to be honest. Every time I see how much you do, essentially you do in a year what many interventionalists in the US do in their entire career. So it's an amazing amount of cases and experience that comes with that, obviously. How do you keep yourself in good shape mentally and physically? Because that's a huge load of work. How do you do it?
So I've just more recent, I think the pre-COVID era was a different one for me than the post-COVID era. I must tell you that. The pre-COVID era was exactly that. I'd be spending a lot of time in the cath lab, a lot of time giving talks, a lot of time traveling, and it was profession. And it was 6 days a week. I must have missed out on many aspects, though I must say that I did learn singing. And around 10 years ago, I even gave a performance in an auditorium in Delhi after I'd learned enough singing from my mentor and the guru. And we gave a performance. And by the way, that was around 12, 13 years ago. And that was the great stress buster for me, I'd say. But the funniest part of this, and I'm going to add funny part to everything, I had these hobbies. But I said, let me do a performance. After all, so in a big auditorium of 400 people, I invited a lot of people to listen to me. Well, the who's who of Delhi was there. But you can imagine that's easy because, I've done angioplasties on a lot of them anyway. But the who's who of Delhi was there, right? From ministers and so on, and the chief minister. And somebody said at the end, I said, I hope, at the end, after an hour of singing, etc. So I said, I hope you've appreciated it. And so there was a lot of clapping. I said, if you've appreciated it, then thank you very much. I owe it to my guru who's been teaching me these lovely songs. And if you thought that I wasn't great at singing, you must remember I do a better angioplasty than singing. I think many of you have experienced that side of mine as well. So that is of course, it's been a great stress buster. So I keep my sense in that. I enjoy traveling. With the family, though I wasn't giving enough time to my family. But post-COVID era, I've cut my PCIs down to approximately 700 a year. And that actually gives me time to spend more time also in other activities that I would like to do. So that give me good enough time.
How about the
Matters
radio?
about this staying sane issue.
Sure.
I think I was at some stage fairly so focused or blinkered around the number of people who wanted to get procedures done from me, around everything, that I did lose a lot of enjoyment of my life, should we say. It was a blinkered world. I mean, it almost seemed that the world couldn't do without me, which is never true. Which is never true. But you get to a stage where everybody says, "Ah, it's what you have to do, and you have to do mine." You always say, "Okay." But I remember this date where I did 42 cases, and it was like 18 angioplasties, and the remaining were angiograms who had come to me, etc. So I started in the morning one day. I finished the next morning at 6 o'clock the next morning. So I was working throughout the night continuously. You can imagine that meant going through 17 angioplasties, and then you 42 cases. Yeah, at 24 angiogram and 17 PCIs. By the time it finished, it was morning, and I was still doing the work. It was 6 o'clock. This last patient who came onto the table at 5:30 was a PCI, and he said, "Gosh, you start work very early. You like Americans. I didn't know you started work at 5:30 in the morning." And I looked at him and said, "I don't want to tell him that he's the last case at 5:30 the next morning," because that would create much confidence in him. But that's a story we all remember. Me and my colleagues remember how that can also happen, that you work for 24 hours and then wake up to say, "Wow, it's another day." Yeah.
Well, again, amazing stamina, right? I mean, it's amazing to be able to do this. I mean, that's again, mentally and physically, that's impressive. Yeah. But I was also impressed that you were doing singing, at a fairly advanced in your career. So how did that happen? Were you always going to do it? Is it something just for stress relief? Was it a dream you had? Because actually you were the first one who had this hobby. So how did this happen for you, and how did it help you?
You're so right. I think it was both. Stress relief is true. Singing provides all of us with stress relief. And can you I'm sure you realize music has no boundaries. It could be a Colombian music. It could be a Colombian song. And if you hear it and you enjoy it, it'd be going through your mind. It could be a Greek song. It could be an Indian song. And that is so good about music, isn't it? And the other thing about music I've always realized is you may be doing a more serious work. You may be doing an angioplasty. Somewhere a tune is going on in your mind, which is relaxing you. A tune which you like, and it's there in the background. So once I realized that, and then this, of course, the Guruji came to me for a PCI, and he was really devastated and he was a very, very good singer and a very famous singer. And when he was devastated because he thought he would not survive, and of course when he did, he said, "Can I offer you something?" And I said, "Yes." He says, "I think you should learn music." And I said, will you teach me? That's how it all started. Will you teach me? He said, "Of course." And he was one of those, you couldn't get any appointment with him if you really wanted to even do. So once he gave me that time, I said, "Gosh, I can't lose this opportunity." And that's how it started. And truly it relaxed me. It actually made me sing at multiple occasions where I felt good. In the morning, I'd be just singing and raising my voice, training my voice. My family would get fed up with me because at 7:30, suddenly I'm here in a room in my office at high-pitched voice, shrieking away. but I guess in a way it was relaxation for everyone later. So yes, it's true. It's a good talent to have. It's always there with all of us, and at no age is it a bar to happiness, to peace, and to joy for everyone. Not just the ones who sing, but the ones who listen also. Provided you sing well, of course. Otherwise, it's pain for others.
No, I mean, that's impressive. And again, I guess a testament of continuous learning. So what has impressed me with you, Ashok, is that you always have this positive approach. Like you always seem, excited, ready to go, motivated, inspiring others. Is that something were you always like this? Always kind of upbeat and positive and inspiring? Or is that something that you're working on?
No, I guess it's an innate nature that, you are. It's, I would say, okay, I have done well. But you know something? If I was to tell you that it took me 3 years to get into medical school because I just wouldn't qualify for the exams and I couldn't get into the medical school, and I said maybe I should become an engineer or an accountant. And in India, it's sometimes our parents who decide what you're going to become. Especially in those days, that's what you see. So my dad said, "No, you got to become a doctor. He's a doctor, so he always said, you become a doctor." He had loads of dreams around me. Anyway, I couldn't for 3 years, and I then did get into medical school. One shot, and the last shot, I did get into one of the medical schools. But the funniest part is, in the first 2 years, our exams, we call them the professional exams. I flunked every exam till the university exam happened after 2 years, and by that time everything had flunked. I wasn't a great student. At least I was a good student, but I probably was having more fun in my life than I ever could. And I had this gang of friends. We were having a good time. And then this happened, and I did get a university gold medal in anatomy. And as the story goes, everybody knows it. I just didn't believe it. I didn't even go to the notice board. In those times, the notice board, you didn't have them come on the email or anything. You had them on a notice board, pinned the results. And they said, "You're right on the top." And I said, "No." And then in the evening, I went and saw it. And then I said, "Gosh." So it was customary for you to actually then go to the professor and head of the subject in which you got, and just next day present yourself to him saying, "I'm so and so. Thank you very much. I got a gold medal in that subject." And I then went that to the professor of anatomy, and I said to him, he said, "Who are you?" And I said, I'm Ashok Seth. I topped the anatomy exam. I got the gold medal, university gold medal." And he said, "But how did you do that? Because you're not a great student. How did you manage that?" So I said that, when he said, "How did you manage that?" I said, "Gosh, this is a disaster. I mean, how can anybody tell me how did I manage to actually top an exam?" And by the way, the single thing in life I learned was that if you succeed from the top, you got to succeed again. Or if you don't succeed again, you get ridiculed and you get forgotten. And I therefore decided I got to stay at the top and I got to give it. But then it continued to happen more as I went better, and I got into this myself, that I've got to remain at the top and actually drive everything. It was then I became an inspiration for others, and then I started feeling I can't fail others. I can always fail myself. But if I'm becoming an inspiration for others, if I'm becoming an inspiration for my fellows, I'm making an inspiration for all the interventional cardiologists across India. If I'm going to be inspiration for across Asia, then I can't fail at any stage. I have to continue so that they can follow the same path. And everybody needs some inspiration, just like I had for Jeffrey Hassler. I wanted to give that inspiration to others. So that kept me going. That kept me doing well. That kept me also making sure that my results were good. That kept me teaching. That kept me sharing. And I think that's been the biggest satisfaction of my life, being an inspiration for others.
And then, Ashok, so essentially it was a success, right? You got the success in this one topic, and that motivated you to keep on that and build on it and expand it to the amazing degree you've done so far. But then I'm understanding is you went abroad, right? So what motivated you to do that? And then you came back. So how did this happen, and how did this shape yourself?
So 10 years I was abroad. And my return to the country was mainly because my parents were in Zambia and my mother kept ill health. When they returned back to India, in India we have this issue, the situation that if you're the only son, yes, you do have to support the family. Their aspirations revolve around the son. And that if you're the only son, then, and I would feel bad. Yes, my mother's ill health in the country. I knew I was only support. My sisters were elsewhere. One of my sisters was abroad. The other got married. And I had felt that I needed to give back to my parents. The giving to the country automatically becomes a part and parcel of coming. But the coming was clearly, and staying back in the country and making it happen in the country was because of my parents. And as we always say in India, not many people may understand it across the world, but we do understand India. If you do for your parents what is expected of you, or what they would want, and at least in the difficult times, then there's always their blessings which continue to give you the best in your own career. I still go back and say I wouldn't have come back to the country. Well, I wouldn't have come back to India for the sake of coming back. There was so much I was doing abroad that would have been fanciful. But I think there are blessings of both the country as well as my parents. which made me do well from India. And I think that's been something which I'm proud of, that I've done well from India as an Indian.
And I guess that's important to give back to the country that helped you study and start in the beginning. Now, when it comes to the people that you've taught and you continue to teach, many of them, can you get a sense when you meet someone for the first time? They come to you, they say, can I work with you? Can I learn from you? Now, after all these years, do you have a sense, are they going to be successful? Are they going to be good operators, good interventionalists, good physicians? Or is it something that is you find out as time goes by?
It's very difficult to analyze an individual right on the first go, but it's very easy to do that within a week itself. So I would say for me, there are three important aspects. Firstly, is he intelligent enough? Oh, he's got to have a level of intelligence. That's sure. I'm sure that he's done his exams, etc. He's intelligent enough. But does he see his limitations? That's my first thing. Does he realize where his limitations are? Because that's going to carry him in good stead forever if he knows what his limitations are. The second aspect is, has he got a clean slate that he wipes off and says, I want to learn and I have nothing here, I'm a clean slate? Because the ones which are the best are the ones which are a clean state on which it is difficult to write, but once you write it, it doesn't get erased. And I think that is so important. The ones who are easy to write on are also the ones who will often easily erase it out, because they'll say, if they're easy to write on, they will perhaps have some other perception of a technique or a skill, etc., and then it'll override that and they may not be right. So the basics have to be so strong that they can never be wiped out from the slate. And that's what I see in every individual. So if he can train himself well, the third thing I want to train everybody and understand everybody is the limitations, but it's also avoiding complications. If he actually can avoid complications and he can have these three eyes, which I always say, that can you train yourself to have three eyes? One eye is your guide catheter, which causes complication. The other thing which causes complication is your balloon right there and the stent or whatever device is on the lesion. And the third thing which causes complication is the tip of your wire. Now, if you got all these three in your vision, you avoided 90% of your complications. Now, can you do that? And if you can do that, you're going to become a good operator. So yes, in a week, I can figure out the ones who are going to have the strength to be a good and safe operator. For me, that's more important. The skills will happen over a period of time.
Wonderful. And then, Ashok, you've done so many things. What are you most proud of from the many things you've done?
It's very difficult on an individual basis. Yes, I'm very proud of being an inspiration for practically almost all cardiologists in India and many across the Asia Pacific region. I think for the years and years that I've been in this field, I would be confident enough to say that most doctors who've gone into cardiology as a fellow in cardiology have always looked up to me and said, we want to be an interventional cardiologist because we'd like to be like him. And that's happened so across Asia Pacific. That's a good feeling. I never went with a mission of doing that as an interventional cardiologist and excelling in the field. But I think it's something that I've given back to a generation. And it makes me happy that they became an interventional cardiologist because they wanted to be like me. And the second thing is the ethics. One of the things which we all have to be proud of is when the country thinks of you as one of the most ethical people in the intervention practice. I think that's important. And all of us are ethic. But it's great to actually be referred a patient or a patient come to you who's traveled up for 1,000 miles for an angioplasty because 5 other people said you need a PCI, and you sit there for half an hour telling him you don't need a PCI. And you can do without it because you hardly got any symptoms, or your lesion doesn't look so well, or you've got a distal occlusion which is so well collateralized that your exercise test is negative. And when you can do that, that actually makes you feel well. So can you believe that I get a load of referrals from interventional cardiologists or others saying, go to him. If he tells you you don't need it, don't need it. If he tells you you need it, have it done, because there's nobody. So I think that's the second thing. But if you want to talk about a procedure where it will always stay with me, which is always going to be so important. Yeah, I was the part of the first in-human study of the core valve. The first cases of the world got done in India. I think the biggest dramatic thing, I think it was August of 2004 when we did the first ever implant of a core valve in the world in a patient with aortic regurgitation. Just to see the valve, just to see a severe AI disappear on the table. Of course, it was Jacques Seguin was there, Laborde was there. Jacques Seguin is the inventor of the core valve. Laborde was there. And then it was a dramatic moment of a disbelief that in a cath lab you could actually see aortic regurgitation disappear as a part of the first in-human study. So 2004. So I think if I was to most dramatic moment was that. I think the rest of the developments came in very gradually over a period of time. But this was perhaps 2000. Alan and I had become very good friends very early on in late 80s and 90s, and a number of my fellows went to him, and he was a close friend of many of us in the country. In 2000, he said that he was going to do this valve, and I said, I can't believe you, but then it happened, and that was a disbelief. But when it happens in your own cath lab in front of your eyes, it's one of the most dramatic moments of your life. So yes, that was a transformational moment of your life. It just sent chills down my spine, I would say.
Well, again, very many impressive things that you've done so many years. But right now, what are the things that excite you the most?
There was, I was also going to say, on one hand, you have the most exciting case, Manos, but I still want to actually tell you the other part of it where you have the most, you can never have the most insightful case. You can never have the most, but you always have a number of memories about cases. Some could be just the way you dealt with it, a most impossible situation. You said, wow, look at this, I did this. Sometimes you have complications, you have to bail yourself out, and you say, thank God I bailed out. Some of those memorable cases are the ones which you can't bail them out, and they didn't survive, and then it just sticks to your mind saying, gosh, why did that happen? Couldn't have done it differently. But if I was to tell you and I'm deviating away from the question you asked, but it still relates to the question you said. The other case which always imprints in my mind is when I did my dad's PCI. He's, thankfully he's 99.3 at the moment and still good and walks around and still reads, by the way, books. He's a doctor, a chest physician, and he still reads books on ventilation and ICU and things like that. And he's one day he was exercising with dumbbells. So that's not a bad thing, light dumbbells. But I did his PCI when he was 85 years old. It's rest angina, bad disease, calcific disease. So I had to rotablate his vessels, put in multiple stents, which wasn't a good feeling. But then I knew that I was doing it because I could only trust myself to that level of complexity to be able to do it. So I blanked myself out. My sisters were sitting outside. I blanked myself that this is not my father. There's another patient. I could do his multi-vessel rotational atherectomy and put stents in, multiple stents in. And it went on for 2.5 hours, that procedure. And I did everything well. And I decided that I would then just, perclose it. And of course, that was fine. And suddenly, the immensity of everything, I was overwhelmed that I'd actually finished a very complex procedure with success. And you suddenly drained me out completely. And can you believe at that point, at the perclose, I missed a click, and I just pulled everything off, and the sutures did not bite, and I was left with a gaping hole, the wire out. And I had to press that for the next 4 hours with my colleagues to be able to stop the bleeding. Thankfully, nothing happened to him. But you suddenly realize that the enormity of what you do suddenly dawns on you. So I said, never would I actually take the focus away. It has to be like you're in a meditation, and that meditation cannot end till the patient leaves the cath lab safely, out of the cath lab into the CCO. And that's only when the meditation ends. So that was another learning. I said, do it for every patient. Your meditation and blinkeredness and whether you focus cannot end just because you're so happy that everything went well. The patient has to be out and fine. And that's always therefore another learning that stayed with me.
Well, that's impressive. And to many people would never dream of doing their own family, which obviously the stress is multiplied a lot. But I mean, to your point, exactly, this case can be complex, and sometimes it's important to focus, but also understand your limitations, right? When it gets too much, when you have to take a break or do something along those lines. And speaking of meditation, obviously, India being the birthplace of meditation, yoga. How has that affected your approach? I know that that's where everything started. Is that something that you consciously think or you practice, or how does that background affect yourself?
We should practice it a lot more, I must say. We should. I do believe that it actually gives you a better perspective, hold on your mind, hold on your body. It actually, yoga is a way of life. And by the way, we are facing the stresses of life. Yoga helps us to face those stresses. So it's not a technique you do for half an hour and say, I've done it. And it actually helps you to absorb all the bashing that our mind and body gets in our profession, the stresses which we get, and helps you. So I do believe that we should do more of it. We don't. We just think of doing a meditation for 15 minutes and believe that will relieve ourselves of the whole day of stresses. But a yoga is a training, and I do that. With the yoga, per se, the exercise part of it can help your back, can help your spinal muscles, helps you to really bear that lead coat and the number of hours of standing. But the yogic way of life helps you to absorb all the stresses. So I think we should do more of it. I must say, I've done very little of it apart from that half an hour an hour twice a week when the yoga teacher comes. But you even find that helpful. Especially over the last 10 years, I've found even that helpful. But I guess it's more an evolution of your own mind and body into a yogic way of life, which is able to absorb all aspects of stresses that we feel.
Ashok, do you have a favorite book or a favorite movie?
These are the questions which you have to sort of be smart enough to answer straight away. But it doesn't happen that way.
No.
But you have to, okay, if I was to go to the movies, I'd say in my childhood, by the way, I still remember, I can divide it into, you like movie at different times of your life. There can never be one movie that you've liked forever. So in my childhood, when I was in my school, I used to lead a lot of history, and some of it was Indian history, but some of it was Western history to do with Romans and so on, and the Roman Empire and how it spread, because it was all linked to a historic path. And so the best movie I liked at that time was Ben-Hur. Ben-Hur. Ben-Hur was a movie of the Roman Empire and the slave who became bigger and bigger. He was a chariot racer, and it was one of the Charlton Heston, or one of those big movie stars. It won many Oscars. Then, in my college days, the movie I still recall where all of us would go gaga was The Godfather. Marlon Brando's picturization of the boss, the mafia boss. That was a great picturization. So all of us would pretend that we are like the bosses. So we like that. That was influential. And I think more later, of course, I think Titanic was one of those marvelous movies. I think that was more in my subsequent years of my life. And you saw this magnus opus, you said, Titanic was still. So these movies go down into memories. Of course, there's the Indian movies. I'd say Sholay is one of them, which has been recent. Mughal-e-Azam is another one of the magnificent past, which was to do with Akbar and his Raj. So those bigger than life movies, There was another movie called Mother India. These are bigger than life movies. They stick to your mind forever. So those are the movies. Now, you asked about the books. Yeah, the book I like most, and I think you may know about it. If I was to ask you, okay, let's separate this out into professional and non-professional. So I was to talk about the medical books. Yeah, we read the medical books. I still remember the first angioplasty book. By the way, we used to absorb at that time. The only way to learn in the 80s was books, or going to one of these courses where you had to take a camera and photograph every slide and then go through that slide and understand what was happening. But one of the earliest books was, of course, from Bernie Meyer himself, and Angioplasty. It was a lovely book in the mid-'80s. And there was George Vetrovec, and I think those were fascinating. But the book in my recent times, when knowledge is profound all over the place, I mean, you really read books because it's everywhere, whether it's social media, whether it's up online, is a book called Manual of CTO Intervention, Step-by-Step Approach. I'm sure you read that, Manu. It's by a guy called Emmanuel Baracus. I think it's actually a book worth reading. And I'm not just saying that for you. I'm saying that for myself. If I have to look at any aspect of expertise, understanding, and going through these tips and tricks, I think I would compliment you and encourage you.
Well, I think you should correct us because you have much more to add there, I'm sure.
And encourage you to read it. No, I truly mean that. I truly mean that. That's the sort of education which is far more important, because it's no more books. It's when you read a book, it has to be automatically as if you're doing the procedure and it's telling you the steps and clarifying. So it's got to be much more practical. A theoretical information is vast upon, but unless every book is practical, and I say book, I may mean any whether it's so many review articles are available, so many step-by-step articles are available, state-of-the-art are available everywhere online. But it has to be so practical that it clarifies your thoughts, clarifies your hands, clarify what you do, and you come out saying, that added to what I was going to do today. So that's what it's all about. But there are other books. Going away from the professional, the book I've always liked is, the first book which was impactful to me to reanalyze my strategies and myself was the Checklist Manifesto by Dr. Atul Gawande. I thought that actually made us think again and again and again, and made us do better than what we were. It certainly stuck to my mind, and it becomes a part and parcel of a change of my habits in many, many ways, and change of the way I approach things, even procedures. And I think this happened during COVID times, that when you had enough time, and when I read through that, I had meant to read Robin Sharma's "Who Will Cry When You Die," and again it changes the perspective to you of life for you. It almost makes you feel there's so much to do for others in your own life. That it's not just work. It's just, I think you've got to revolve around how much more can you do for everyone else. Which actually brings me to the question which we missed out, and you'd asked me, what is it going to drive you from here? What do you really want to do? So apart from the fact that still at this time, even at the age of 68, do continue to lead the field in multiple ways, including doing 700 to 750 PCIs a year. And of course, there's the TAVR, the transcatheter valve replacement, and the structural therapies that I want to get into. There is clearly one thing I want to do, is to create a huge foundation which actually would transform the care and equity of care, healthcare and cardiological care in the country, which means that, we live in diversities in India. There are people who can afford high level of therapy, and who can afford Impella supported PCIs and so on, and everybody pays out of his pockets. This is a world where we pay out of our pockets for treatment, and there are many who can't pay that treatment. I find myself asking my question, of course we can't have a 1.2 billion people all being paid for, but we can certainly have quality-based equity of healthcare in which say there's no reason why a PCI done in my center, which is a national center, should be any different to a PCI done in a small city by anybody else. There's no reason why his thrombolysis got to be different and my thrombolysis is going to be different. There's no reason why he's going to have thrombolysis and not PCI. There's no reason why his outcomes in that small city, 1,000 miles away, should be any different to the outcome I give him, at least for the routine, non-complex cases. And I think we got to deliver quality care, even if it's the simplest form of care. So that I think I'm going to create, the next step is this huge foundation. I know that I can get enough money into it, but it'll actually be on numerous aspects. It's going to be on patient education. It's going to be on physician education. It's actually going to be diverse in terms of saying how can equity in healthcare happen, but it's not just equity in terms of delivery, it's equity of quality of healthcare and outcomes which can happen down the country. I think that's going to be a clear mission of mine, and I hope that we can actually have an interview 10 years later saying, how did you achieve this and what did you do, which is transformational in this aspect? And I think it's time for me to give that back to my country.
So most people in the US, that you ask them, what is your plan at age 68? I would probably answer it's golf and relax. So I'm hearing from you that actually, if anything, you want to create this huge endeavor, which will be extremely, obviously, influential and impactful for India and the people. So it's really fascinating. So how do you get this energy again for to be able to plan and think big and have big dreams and big goals, even at this stage of the game?
The life is much longer. I mean, I'm still counting years, not backwards, but forwards. It's not a countdown. It's still a count up. But there's also, the more and more you succeed, and the more you actually become iconic, it's actually a bigger responsibility to deliver, not for yourself anymore, but for others. It's a greater responsibility to look and ask yourself, what have I done for others? No more. And by the way, 10 years ago, I would ask, have I done enough for myself? Can't I do more? Maybe another award? Maybe perhaps, why not a live demonstration? Or maybe this or maybe that. And it's all for you're looking only at yourself saying, what's my next step? Why don't I write another paper? I think there's a great opportunity to write this one up. It'll get published and it'll get more reviews. But then there comes a time when you ask yourself, okay, as a part of profession, I've done a lot for others. I've probably treated thousands of patients. I've benefited them. Their relatives are happy. Then there's loads of more than 500 interventional cardiologists in this country who've been trained by me. And then I say, no, I'm asking differently. It's not as a part of your profession. What have you done? And that's I'm asking myself. What have you done as a part of your efforts for the public, not as a part of the profession? And if my efforts haven't multiplied out to thousands of people, and they've only multiplied out to the ones I treated, how many more I could actually benefit if I did something which was different like that? And therefore, I say that's the reason why I say that's a part of relaxation. That's a part of retirement in a way, isn't it? At the end of the day, it's a part of retirement. But look, I could put so much money into research and actually encourage all these youngsters and across the country. Now, if they create good research and good science and something comes out of it, it multiplies into benefiting loads. If even innovations, and it was indigenous innovations, transform the country. And we've had, of course, the transcatheter heart valve from this country, but perhaps it could be impellers in this country. It could be any devices. We could actually promote that. We could actually put research and science together. We could have all these institutes of engineering which could combine with the doctors to actually create so much of technology and technique. So I think that is, in a way, retirement. That's, in a way, relaxation, because this retirement does never mean that you have to have good time, fun time all the time for the next many years. This is also fun. This is also great excitement. And yes, of course, you still have time for having the fun. Oh, by the way, my fun, I did a lot of scuba diving. I'm a certified scuba diver. COVID stopped me. And this year, I'm going to get back to my scuba diving. I want to get back to singing. I want to get back to traveling. Want to spend more time with the family. That's something which I've missed out in my life. So I think there's a lot of ambition there, but there can never be. I think there's still a lot of giving back to the society for all of us.
Well, again, Ashok, you've been an inspiration for myself and many other people. If you had to summarize for people who are young or starting or early in their careers, how to get effective and successful, what would your piece of advice would be?
So let me not sound I may sound philosophical on this, but I think you'll just have to. Everyone who listens to this has to absorb them about what I say in their own context. I just say there are 3 or 4 aspects of success. And I must say that success is defined in multiple ways. Early in my, and the definition keeps changing, isn't it? Early in our own careers, I think the success meant, will I get my next good fellowship? Will I get it at the right place? And if I got that, I was just great. I thought I'd broken this. And then you get to a profession and you say, am I get to the top of my ladder? Am I actually going up my ladder? Am I being known? Am I being recognized? Oh, I got my first live case at the TCT. Wow, isn't that big? I'm going to do a live case at the TCT. And that's success. And then you transform that success into realizing that, did your children do well? And did they get into a college? And did they get into a good college? And say, that's a success. So I say success has a different meaning. When you made it big and you bought your first huge, nice Merc or a huge car, you say, that's become successful. You bought a big house or a mansion with swimming pool, you say, that's a success. So it changes in terms of perspective. But I'll tell you where I always focus on. I say, there's no question that for being successful, and define it whichever way you want to do, for yourselves a different part of life, you have to be, firstly, a good doctor and a good man. You can't be the richest doctor. You can't be the richest, the most flamboyant person, the most well-dressed person. You can't say, nobody talks gives a lecture like I do. Look at the way I talk. You just got to be recognized by the community as a good doctor and a very good man, not the richest doctor and not the most flamboyant doctor. The second part I say is, be focused, be committed. There's no question that without focus, without determination, without commitment, you can't have a success. For me, the 4 C's of success, by the way, are care, compassion, competence. Care, compassion, competence, and I always believe that if you have these 3 ingrained on you, then you're actually going to be doing the right thing for the patient, which also will include ethics, which also will include enough knowledge to be able to deliver that. Finally, I say, you cannot become great unless you have the blessings of your parents, which we believe in our own country, and I know many countries believe in that, but it may not gel with everybody across the world, because that, of course, relates to your cultural beliefs. And care of your parents, and the blessings of the laws of patience that you actually treat. And finally, I always say that science has made us grow so much beyond believing ourselves that we're gods. And we've seen the best of science in the last 50 years to see medical science. Right from, even we saw the best of science, right from the Wright brothers taking off in 1905 to man landing on the moon in 1968. Can you believe it? Just in 40, 60 years, we saw a revolution of science. If you take medical science, if you take right from the first Zeus computer in 1944, we see a World Wide Web now. Right from the fact that a penicillin and Banting and Best brought out insulin in the 40s to now, we've seen in front of eyes, you and I have seen revolution just of an interventional cardiology. What we did 30 years ago seems crude, seems unethical to us. What we did 25 years ago seems unethical to us. What we did 20 years ago is weird to us. We've seen so much. So some of us have certainly believed, and many of us too, and I used to think that we becoming like gods. We able to give lives to people. But that's a wrong thing, because I could actually just walk down the stairs, fall, tumble, break my head, have a concussion, and never be able to do an angioplasty ever again. So the greatness would actually disappear in a split second, isn't it, at the end of the day? So the greatness on one side is where I say, I'm God, I'm giving you life because I've got these skills and these techniques and these devices, and you are going to be, you came in a shock, and today you're walking out because of me and science. And then on the other hand, I walk down the stairs, fall, and I'm in coma for the next of my life, and the greatness is gone. So I believe that there's science and spirituality, and we got to understand the humility around what we are able to achieve, because there's spirituality. And if we live with science and spirituality together, then if we dissociate, if you're only going to do with science, then we are living on the earth. But if we understand this aspect of things, that we're living in society, we understand science, we then understand spirituality. We put those together, we start living in the world, because then we're living with each other. That's when we talk about how to help each other. That's when we talk about what can we do. That's where we become humble around everything. That's when we say, we are no more gods. And we are, therefore, still the human beings. And there's somebody else who created us, who made us. And that's why we are there. And that's why we are able to treat our patients. So I think my message to everyone is just think of these four aspects. And if you think of these four aspects, then I think you become a very good interventional cardiologist. Put it all together.
Wonderful. Well, Ashok, again, I can't thank you enough for taking the time today. It was very insightful. Not only, I think it's not just for interventional cardiologists. These lessons, I think, apply to everyone, regardless of what they do. And you're right, these are global principles that apply to everyone on this planet. So thank you again. Thanks so much again. And very excited and happy and delighted and thankful working with you, and look forward to continue work with you in the future.
It was great to have this conversation, almost as if we're sitting in our living room. Manos, I wish you could be here, but it's been wonderful speaking to you. I may have sounded philosophical at the end, but believe you me, we are doers who really, if we're not philosophical, would forget the path that we've taken and forget the path which we've got to transfer on to others. All of us have the same beliefs. We say, when we come out of our labs and the patient's doing well, we say, thank God, he's done well. It's never thank Manos that he's done well. It's never thank Ashok, he's done well. But good luck. Always keep doing the great work. I always admire your work. Always admire the messages come out of you. And I think the transfer of energy and the transfer of education, which has come from your Manos, has really been very insightful for a lot of trainees and a lot of young gen and many interventional cardiologists across the world.
Wonderful. Thanks again, Ashok. Thank you so much.
Take care.
Thank you for listening to the Sensei podcast.